Good evening. I'm Marcia Fox, President and CEO of VNA Hospice and Palliative Care of Southern California. Tonight, at our Meet the Experts event, Patty Meinhardt, VNA Director of Healthcare Partnerships, will be talking about the Affordable Care Act. Patty will be highlighting information on subjects such as the health insurance marketplace, young adult coverage, free preventative care, and home care and hospice care in conjunction with the Affordable Care Act. Welcome to our Meet the Experts event.
Well, I just did a summary of the Affordable Care Act, and I asked anybody if they had read the Affordable Care Act, which is 1,000 pages, and no one had. It was kind of interesting that so many Americans don't even know what the Affordable Care Act entails. So it was nice to be able to do a brief description of some of the components of the new law. It is very complex, and there's so many different components. But overall, I think it's good for the citizens of the United States to have coverage. How they obtain that coverage may be questionable. Like I said, there are so many components. So we talked about accountable care organizations, the patient-centered medical home, health literacy for the common person. We talked about coverage for young people, those individuals that don't have coverage after they're 26 and their parents. Coverage is no longer available to them. And we talked about Medicare and the solvency of the Medicare program. Medicare will be solvent till 2024 with the Affordable Care Act. Without it, it'll be insolvent by 2016, which is just around the corner. We look at saving billions of dollars so that this can continue. You know, we have the baby boomers, and every day 10,000 people turn 65. We look at the population growth. In 2050, there will be more than 50% of the population that are over 65. And so we're going to be taking care of a lot of aging citizens of the United States, and we need to prepare for that. The Affordable Care Act addresses the solvency of Medicare, and if they don't do anything, there won't be coverage for anyone. And as we know, health coverage is very expensive. The whole idea is to make it affordable for everyone. One of the great programs that we're doing to help with reducing cost is helping the acute care facilities reduce readmissions. And I've spent a lot of time educating case managers and physicians on a program we call No Place Like Home, which is to reduce the rehospitalization of high-risk patients.